Good evening and welcome to tonight's webinar on NHS Pension Update, the Pension Choice 2 Revocation exercise. My name is Graham Crossley. I'm a director at Medifintech. If you do need to sort of get in touch with us, then you can do so via the email address that's on your screen now. I'm quite vocal about NHS pensions, so if you are on social media, then please do give me a follow on Twitter, which is just www.twitter.com/GDC UK. Now, for those of you who might not be aware of who we are at Medifintech, we are NHS pension specialists, and we have an excellent reputation and unrivaled technical knowledge of NHS pensions. Our team consists of individuals who were specialists at NHS pensions before they moved to Medifintech, and collectively there's over 115 years worth of experience of working within NHS pensions. We work directly with members, as well as supporting hundreds of accountants, financial advisors, and also professional organisations who work within the healthcare sector. We've helped thousands of healthcare workers understand their NHS pension and taxation, and saved millions by identifying and correcting annual allowance errors and pension record errors, which is not surprising that we've now got an excellent Trustpilot rating there. And if you did want to sort of find out more about us, then the QR code, if you just take your phone and scan that, that will take you directly to our website. So tonight, what I'm going to go through is the scheme details, how you can check your pension records, some of the updates we've seen more recently to NHS pensions, and then moving on to McCloud, and then the main element of reason for tonight, the pension choice exercise and the pension choice 2 revocation. We might not get much time for a Q&A session. Thank you so much in advance for all the questions that you did send in. We had lots and lots of questions, so I've tried to build those questions within tonight's slide deck so that we can cover those off. And as I say, do get your phones ready, because there are links to additional content via QR codes as we go through. Now, a copy of this webinar recording will be posted to our YouTube channel, which I've put in the chat link. So if you want to find out where that is, just go to the chat link, and then you'll be able to see this webinar and some of our previous ones as well on there. Before I do begin, though, I just want to say thank you very much to this Facebook group. So there's a Facebook group which has got nearly 36,000 members, who are very kind enough to let me ask for a guinea pig in order to do a case study for tonight's webinar on the pension choice exercise. I'm a very strong supporter of these types of groups, because the NHS pension scheme itself is ridiculously complicated, and you don't always need to pay firms like Medifintech and others to get support. Within this group, there are a number of very knowledgeable admins and also members who give up a lot of their time to support others. So again, if you need general support, I would suggest registering with this Facebook group. Their QR code is at the top of the screen, and also the URL is down there as well. So yeah, once again, very much thanks to that Facebook group. And the whole world of NHS pension support is actually quite a small one, and you'd think we'd probably be more competitive with each other, but instead we're actually quite supportive of each other. And I want to sort of draw your attention to this other group. And there's another company called Medics Money, who provide a lot of general support and information, and they bring together a lot of professionals and specialists, and they've just reached 1 million downloads of their podcast. So if you are looking for some additional resources and some additional information, then again, go to their website or look at the scan the QR code. It will take you to their blog, which has links to all of these podcasts on there, which I've been very fortunate to be on quite a few of those now. And I think I've got another one coming up with Laura from Pengage, who's another company that operates in this space, where we all talk, share ideas, and try and work out the best way forward for members. So let's get into the content of tonight. So the first thing is the scheme details and how it works. So there are two main types of pension schemes. So there's a defined contribution pension scheme, whereby your contributions are defined at the outset. So you put money in, your employer puts money in, And then with a combination of investment return and tax relief, you hope that that pot will grow and grow and grow depending on what your attitude to risk is. And then when you reach retirement, you will simply take money out of that pot in order to fund your retirement. Now, the amount of retirement income is completely unknown at the outset. Only what you put in is known. Now, within the NHS pension, there is no pension pot. It's a defined benefit scheme where instead of putting money into a pot, you build up entitlement to a pension. And that pension entitlement is based on how many years you've worked and also the pensionable pay that you've earned during your career. Now, this is a government-backed pension. It's a secure pension income for life, and it will increase each year by the consumer price index. So it goes up with inflation. Now, the pensions and payments are actually paid for by the pension contributions of active members, and there's a significant surplus. If ever that were to change, then government would step in and make sure that your pension was paid. So this is why this is always referred to as a gold-plated pension. Now, within those defined benefits, there are two types. There are the old final salary benefits, so that's your 95-2008 scheme, whereby your pension entitlement is based on each year of pensionable membership, including your part years and days. And then we have the newer scheme, the Career Average Revalued Earnings Scheme, or 2015 scheme, where your pension is based on your pensionable earnings within a scheme year from the 1st of April to the 31st of March. Now, if you're joining this Pension Choices 2 webinar, you are more than likely going to have a foot in both camps. You'll have some final salary benefits as well as some career average revalued earnings benefits. So let's look closely at those 95 section benefits, because this will be important when it comes to trying to decide whether or not you want to revoke that Pension Choice 2 election that you may have made back in 2015. Again, QR code at the top of the screen will send you to a link to the actual more details on the scheme. But in essence, for all of those days and years that you build up, you will get an 80th of your pensionable pay as an income in retirement. Now, the definition of pensionable pay is the best of the last 3 years. So if your pay does go down a little bit, there is some protection. And we've had quite a lot of questions actually on how this works. So we're going to go into that in a little bit more detail later on. Now, if, however, your pay has actually gone down significantly, whether, for example, you've lost a Clinical Excellence Award or you've stepped down into a less demanding role, or even if you had a period of time out of the scheme, well, there are things called pay protection that can enable you to protect a previously higher level of pensionable pay. Now, if your pay has dropped and you've never done anything about pay protection, well, there are limited deadlines, but sometimes you can appeal, and we've had some good successes in getting some retrospective pay protection applied for members. Now, in addition to that retirement income, you also get some tax-free cash. Now, that tax-free cash is your pension times by 3, but if you want more tax-free cash, you can have some. You can exchange £1 worth of your pension for £12 worth of lump sum, subject to some maximum limits. Now, the normal pension age for the 95 section is age 60, and there are no late retirement factors. So if you go past the normal pension age, you are effectively burning pension. It won't be backdated. The minimum pension age, if you did want to take your pension early, is age 55. Now, this is actually changing to 57 from April 2028. But the majority of 1995 section members should be okay, because the minimum pension age is baked in at 50 if you joined that 95 section before the 6th of April 2006. So it's only if you were joining between 2006 and 2008 that you might be impacted by this change in minimum pension age. Now, if you do go early, well, there's no penalty as such. What happens is that there's an actuarial reduction, which means that your benefits are reduced to reflect the fact that they are going to be paid over a longer period of time. So let's take, for example, you've built up a £20,000 pension and a £60,000 lump sum. Well, if you were to take that at 55, you would be entitled to 81.2% of your pension and 91.9% of your lump sum. So you get £16,240 and this £55,140 lump sum. Now, if you add up all of those extra monthly pension payments between 55 and 60, you're getting £77,500. Now, it would have taken 25 years for that pension to equalise by waiting. So, as I say, what the actuarial reduction does is it gives you the same amount of pension, but over a longer period of time. So you receive a little bit less when you retire early. Now, there are some members who actually get to take their pension early without any actuarial reduction. So these are people who've got special class status, and there's a subset called mental health officer status as well. So special class status is typically nurses, physiotherapists, midwives, health visitors, and sometimes some senior management if they have a nursing qualification that's essential for the role. Again, there's a great fact sheet from the NHS Pensions if you scan that QR code there. But this is only if you were a member before the 6th of March 1995. Now, for mental health officer status, you need to spend almost all of your time in the direct treatment and care of patients who are mentally ill. And in addition to getting that normal pension age of 55, you also get double the amount of service for each year once you've gone past 20 calendar years. There's something called doubling. Now, historically, with regards to those who got special class status who retired at 55, if you returned to work, there was a risk that your pension could be reduced if your earnings were too much under a system called abatement. Now, that was suspended because of the pandemic, and the government wanted more workers to come back from retirement to help out. And we're very pleased that after lots of campaigning from many, many people, government have now confirmed they are going to abolish abatement for special class status abatement completely from April. If you have had special class status or mental health officer status in the past, I would urge you to check your pension record to make sure you've not lost it. We've seen all too often that accidentally, because someone has moved from one trust to another, that special class status has been sort of forgotten on their pension record. So moving on now into the 2008 section. So instead of 80ths, you now get 60ths of your pensionable pay for all those years and days that you build up. And the definition has been enhanced to the average of the 3 best consecutive of the last 10 years uprated pensionable pay. Bit of a mouthful, but what it's trying to do is giving you some protection against inflation. And again, we've had a lot of questions about how this works. So I'm going to go into that in a bit more detail as well later on. So unlike the 95 section, there is no standard tax-free cash. But if you want some tax-free cash, you can exchange £1 worth of pension for £12 worth of lump sum. And if you're a pension choice member, well, when you moved across, you have to take a mandatory lump sum based on your 95 benefits when you moved across. And to achieve that, they will reduce that 2008 pension by £1 for every £12 of lump sum that they need to give you. Now, the normal pension age for this scheme is 65. But if you work past 65, there are late retirement factors available. If you wanted to retire earlier, you can do. The minimum pension age for this scheme is 55, and it's actually baked into the regulation. So even though the rest of minimum pension ages are going up, this scheme does not change. It will stay at 55. Now, if you are on a less than full-time contract, then with all of these final salary schemes, what happens is they are actually based on the whole time equivalent pay. So let's say, for example, you were earning 20,000 and you're working 0.5 full-time equivalent. Well, the whole time equivalent would be 40,000. And there's a quick tip on the screen now, which is basically to work it out, you take actual pay times by the standard hours divided by actual hours. So what this means is that now that nobody is actually contributing and building up new service within the old final salary schemes, if you move from a full-time role to a less than full-time role, it's not going to impact your pension. It will do for the career average revalued earnings scheme, and we'll come on to that in a moment. But for these old final salary schemes, going less than full-time towards the end of your career won't make a jot of difference now to how that pension award is going to be calculated. So let's move into some more detail then on calculating this pensionable pay, because it's a significant cause of confusion. So pensionable pay is based on periods of active membership. So let's say, for example, we have a scenario where a member opts out and they rejoin with a significant reduction in their pensionable pay due to a very, very expensive salary sacrifice lease car. Not from going part-time, because remember, if they went to part-time, then it would be uprated to whole-time equivalent anyway. So in this scenario here, they've gone from 40,000 to 45,000 to 50,000 to 30,000. So when they look at their payslip, they'll see full-time is £30,000 as their pensionable pay. That's not what's going to be used for calculating their pension benefits. What they will do is they'll look back for 365 days of active service to calculate the last year's pensionable pay. So we take that first 183 days, get to the opt-out period and jump over that, and then find the remaining 182 days. Add those together and we've got £39,972. So we now need to look back for the other 2 years. So again, we go back for another 365 days, and adding those two together gives us 47,500, and then back to year 3 and do the same process again. That's 42,500. So the best of the last 3 years is actually that bit in the middle, the 47,506. Now, sometimes when you're dealing with historic pay, you also have to account for something called pension increase factors. Now, normally, we don't talk much about this in these webinars, but it has a significant impact on the 2008 section. So I'll go into it in a little bit more detail. So these pension increase factors are the mechanism that are used to increase pensions by inflation. So it's currently using previous September CPI, and they tend to be issued around about sort of January, and they will tell you how your pensions are going to be increased going forward. So it will increase your pension in payment, and also it will increase the calculation of pensionable pay in some circumstances. When they announce these, and there's a QR code that takes you to the latest one, there is an income multiplier table where it breaks down each and every month and shows you that if, for example, you retired between the 26th of March 23 and the 23rd of March 23, then from the 8th of April next year, your pension would be increased by 6.7%, which is the same as last September's CPI rate. So this is actually used in the pensionable pay calculations for 2008. And unfortunately, 2008 calculations are ridiculously complicated. So thanks again to that Facebook group, because this is the case study, and we'll start going through some of their details now. But again, pensionable pay based on periods of active membership, and it's that average of the 3 best consecutive of the last 10 years uprated pensionable pay. So we have to look back at all of the different slices of 3 consecutive years. So we can see here, going all the way back to 2014, how the pay has progressed. And what we then need to do is average those out. But we also need to apply these pension increase factors to bring them in line with inflation. So you'll see there that the highest pensionable pay is actually the latest one, the 53,720. But if you look back towards some of the early years, well, when you take that pay and apply inflation, they were getting quite close too. And that's very important with what's been happening recently with CPI, because we'll see for this member going forward, that new pensionable pay will be overtaken by one of the historic pensionable pays as the best of the average of 3 in that last 10. Fortunately, because this is a real case study, we're able to double check our maths. And when we look at the total reward statement, which was printed just on the 7th of Feb, and that data was up to the 31st of March, it confirmed that their pensionable pay was 53,720. Now, what the key takeaway from this is that pay increases tend to generally take 3 years to apply if you have a big increase in pay, whereas in that 95 section, a big pay increase would apply pretty much straight away. But CPI changes have a significant impact on the 2008 pensionable pay, whereas they don't on the 1995 section. So let's have a look at some quick examples. So 1995 section, let's say you had 30 years membership with a 50,000 pensionable pay. Well, that gives you a pension of 18,750 and a lump sum of £56,250. Compare and contrast that to the 2008 section. Well, same pay, same service. The pension is higher at 25,000, but remember you need to get to 65 if you want this without any actuarial reduction, and there's no automatic lump sum. Moving on into the 2015 scheme, and again, there's a QR code to that scheme booklet as well. Now, instead of all of those years and days, you are actually building up your entitlement based on your pay for the year. So you get an entitlement based on 1/54th of your pensionable pay. This entitlement is then revalued each and every year by CPI plus 1.5%. Now, if you opt out, it will only get increased by CPI, so that's Consumer Price Index. And if you rejoin within 5 years, then all of those 1.5% will be applied retrospectively to the point that you opted out. Now, like the 08 section, there is no standard tax-free cash, but if you want some, you could have some, you give up £1 worth of pension and you'll get £12 worth of lump sum. The normal pension age for this scheme is state pension age. So if government increase state pension age, this will automatically increase too. If you work past state pension age, there are late retirement factors that will enhance that pension. If you want to go early, you can do. This is one of the biggest misconceptions I see on the 2015 scheme. People think that they've got to work to state pension age. It's up to you when you want to work to. The minimum pension age for this scheme is 55. Again, this is going up to 57 from April 2028. And there are those actuarial reduction factors that just simply spread out that pension over a longer period of time. So, for example, if you were going to be retiring at 60 and you wanted these 2015 benefits, you would be able to take 71.1% of those benefits. So just to give you an example of how this accrues, let's say you were earning £50,000, you get a 54th of that as your entitlement. So year one, your pension entitlement that you've built up is £926. In year two, you build up another £926, and that first year's award has now been increased by CPI plus 1.5%. Fast forward for 4 years, you've now built up an entitlement of £3,903. If you compare that to the 95 section, well, that would be 4 years, 2,500. Under the 08 section, 3,333. So each of these schemes accrues pension rates at different rates. So one thing I would urge you to do is to check your pension record. The first and easy one to do is just to sort of see where you are, is to look at your total reward statement. So you can do that via the URL on the screen, scan the QR code, or access it via ESR. And it will show you what the value of pension and lump sum that you've built up based on being at normal pension age. It also shows you this thing called a hypothetical annuity cost, which is basically telling you how much it would cost you to buy this pension privately. If you look at the 2015 scheme, you'll see the pension on there. You'll never see a lump sum because there is no lump sum entitlement, but you will see a breakdown of the earnings and the pension that you earned for each of those years, which is earnings divided by 54. Now, one other document that I would urge you to get hold of at least once in your career is this one. So it's the Annual Allowance and Service and Pay Extract Spreadsheet, or the 05 AAN Service Extract, as it can be called by NHS Pensions. Now you can call 0300 the 330 1346 to get this, or email the address that's on your screen now. One thing that's very useful is it gives a complete breakdown of your annual allowance history. It's going to be a bit out of date because of the McCloud Remedy, and I'll come on to that in a moment. But one thing that's really, really useful is this service and pay section. So for every role that you've undertaken within the NHS that you have pensioned, it has here the start date, the end date, and the amount of pensionable pay. If you're on less than full time, it will also show the hours if you worked, the standard hours for that employment, as well as the sessional rate or hourly rate as well. And again, from that, you can work out those whole-time equivalents that we were talking about before. Now, what's good about this is it makes it an easy way of trying to spot if there's any errors. Now, we find errors in about 1 in 8 cases. And if you have missing service, it can have a significant impact on your NHS pension benefits. If you do have missing service, don't worry, there is a process you can follow. Again, if you want access to these forms that are on the screen, the QR code takes you straight to the NHS BSA website. Because all you need to do is get evidence of the missing service. Now, appreciate if the missing service is back in the 90s, then it's going to be tricky trying to find a payslip or a P60 with this information on. But you don't have to worry, because what you can do is contact the National Insurance Contribution Office and ask for a copy of your contracted out history and then send that to NHS Pensions, because that will be evidence that you were in the scheme. There are also people, and we had a few questions actually on this, of people who have moved between the different nations. So in Scotland, their NHS pension is actually the SPPA scheme. In Northern Ireland, it's HSC, and in England and Wales, it's the NHS BSA. Now, you would have thought when you moved within the NHS, your pension would follow you. Unfortunately, it doesn't unless you take specific action. Normally, you have to transfer your pension into the new nation within 12 months. However, if you've accidentally left service in another nation, don't worry, late intra-nation transfers are possible, and we've had a lot of success in getting those through. We've also seen quite a few errors with regarding pension taxation. I wasn't going to cover this, but we did have quite a few questions come through about annual allowance. So there may be some of you who could have been subject to some of these errors. I'm going to cover them very, very briefly. The QR code there links to a Twitter feed that I did that has more in-depth detail on each of these errors. But we've saved over £4 million now correcting these pension record errors. So one of which is the best of three. So remember when we were talking about 95 section benefits and how you calculate pensionable pay being the best of the last 3 years? Well, up until June 2020, NHS pensions only used last year's pay. So if your pay went down and then up again, well, you could be paying tax on the same pension growth. We also have something called misallocated arrears. So if you receive pensionable pay that should have been paid to you in a previous year, and big culprit on this was the old clinical excellence awards and delayed awards, that can create an artificial spike in your pensionable pay, which means that there can be an artificial spike in pension growth. And we've had members who have had tax bills of thousands and thousands of pounds when they shouldn't have had them. And then the last one is incorrect carry forward, because under annual allowance, you're allowed to use any unused allowance from the last 3 years, but those 3 years are impacted by the 3 years before them. So we see a lot of the time people don't use the right numbers in order to calculate what their tax liability is. So moving on, there are a few pension updates that have a significant impact on your decision as to whether or not you should stay within the 08 section or whether or not you should be moving back to the 95 section. So the first one is the 95 section, the retirement flexibilities on retire and rejoin. So prior to April 2023, if you came back to work, you weren't allowed to participate in the NHS pension again. You have to be moved into one of these nest pensions, which is one of those defined contribution type pensions that we talked about at the very beginning. But from April 2023, pensioner members of the 95 section can now rejoin that 2015 scheme and build up new pension benefits. They've also scrapped 16-hour rule, so you don't have to limit your time as well when you come back into the scheme. Now, this is especially useful if you are a member of the 95 section and you have reached normal pension age. So that's age 60 or 55 if you've got special class or mental health officer status. We also then saw in October of last year an extension to partial retirement, where they're now allowing 1995 section members to take partial retirement. Previously, this was only available to 2008 and 2015 members. To do this, you have to be an active member. So if you've opted out and currently opted out, well, if you've deferred for less than 5 years, you need to rejoin the scheme in order to take advantage. If you've deferred for more than 5 years, then don't worry about partial retirement at all. It doesn't matter. You can just simply fill out an AWAP and take those benefits. You don't even need to tell your employer. If, however, you do go down the route of partial retirement, you can take between 20% and 100% of your pension benefits. And if you want to, you can say, I only want those old final salary benefits, and I'll leave my 2015 benefits to keep building. You get two options where you can do this, and there's a big condition on partial retirement. You must accompany this by a 10% reduction in your pensionable pay, or 10% reduction in commitments for practitioners. And you've got to do that for 12 months. Otherwise, those pension benefits are going to be abated. Now, what's daft about this is this whole partial retirement was introduced by the government in order to encourage the workforce to come back and stay in work after normal retirement age. It was a great idea, but unfortunately the execution is a little bit left to be desired. Now they have said that it doesn't mean less work can be done overall, just that the pensionable element needs to reduce. Now, we have seen a postcode lottery on this. We have seen some trusts who have been excellent in adopting this policy. They have taken the government's proposal and the intent, and they have enabled people to take partial retirement without reducing their hours by simply allocating some of that pensionable pay to being non-pensional. And fortunately, we had a good article in the press just last week. And again, thanks to that Facebook group that I mentioned earlier, because they allowed me to put a poll within that group. We had over 126 people respond and identified that 10% had actually been refused partial retirement totally. So it's a great policy, but it's been poorly executed. We've seen NHS employers try to fix this. They did an update back in December last year, where again they reiterated that reducing pensionable pay while maintaining the same level of work is not necessary, and they've even put on there a guide for employers on how to change ESR to facilitate this. If you want to see that update and look at that ESR guidance, then again, please do scan that QR code. Unfortunately, Government seems to be making this even more difficult than it needs to be. Nobody wants this 10% reduction of pensionable pay. We've just had a consultation close on NHS pension regulation changes, and in the government response, they had an opportunity to scrap it, but they said that there's no appetite to scrap this 10% reduction. So instead, we have these very dodgy workarounds that some trusts will allow and others simply won't. We're hoping there's going to be even more guidance coming out on this to try and help employers implement as the policy was intended. So moving on to the McCloud Remedy. So this started all the way back in 2011 with the Hutton report, which proposed reforms to public sector pensions. They were deemed to be too expensive, people were living too long, and they wanted to move away from these final salary schemes and move everyone towards these career average revalued earnings schemes and change retirement ages to much later and in line with state pension age. They mentioned specifically that special protections for members over a certain age should not be necessary. However, when these reform schemes were introduced, so that's the 2015 scheme in the NHS, it had this transitional protection for older members that let them stay in the older pension schemes. Now, not surprisingly, the younger members were aggrieved, and so the judges took this to an employment tribunal under the name of McCloud. Firefighters did the same under the name of Sergeant, and it escalated through the courts until 2019, when the government accepted that this age discrimination needed to be remedied. So who does this impact? Well, it's all members in service on or before the 31st of March 2012. So that's people who are still working, still contributing to the pension scheme, people who might have left the pension scheme but are still working, those deferred members. And it also includes people who have already retired, whether that be through a standard retirement or through ill health, or even if you're in receipt of a spouse or dependents pension. It also includes those people who had that transitional protection that didn't even move into the 2015 scheme back in 2015. And there's a lot. There's nearly 1 million, well, over 1 million people who are actually impacted by this, 277 of which have already retired. So there's a lot that needs to be remedied. So what's going to be done to remove this discrimination? Well, the 2015 scheme itself is not discriminatory. It's this bit, the transitional protection, the bit that said that those closest to retirement age got to stay in the 9508 scheme. That is being removed retrospectively. In its place, members are going to be given a choice, and that choice will apply to the benefits accrued during the remedy period, which are the 7 years between 2015 and 2022. Now, your choice will apply retrospectively to the benefits that you built up during that period of time, and you will get to decide whether or not you want those benefits to be in the legacy scheme, so the 1995 or 2008 scheme, or the reform scheme, so that's the 2015 scheme. So now that you're looking at deciding your pension choice to revocation, this is important because not only will you be deciding between the legacy scheme or the reform scheme, you're now deciding which of those legacy schemes that you actually want to put those benefits into. Now, the choice for the McCloud Remedy has to be done when you take your pension benefits. The pension choice 2 revocation, well, that has to be made a lot earlier. However, with regards to McCloud, there are some important events on the timeline that you do need to be aware of. We've already seen McCloud Part 1. That was the bit whereby in April 2022, all continuing pension accrual was in the 2015 scheme. Even if you had that transitional protection, everybody accrues benefits in 2015 from the 1st of April 2022. From October last year, we had the first element of the of Part 2, which was the rollback. So all of those benefits that you built up between April 2015 and April 2022, they have already been rolled back into the 95-2008 scheme. There's no choice on that. It's just happened. As a result of being rolled back, there are some impacts. So first of all, those annual allowance calculations that you may have been calculating over those 7 years, well, they're all wrong now. They all will need to be redone and reviewed and accounted for. If you bought any additional features on the 2015 scheme, such as the early retirement reduction buyout or added pension, well, they will now need to be transformed into benefits within those older schemes. Now, there is no ERBO, that early retirement reduction buyout, on the older scheme. So you will either have to keep it for if you make a choice to go into the 2015 scheme, get a refund, or exchange it for additional pension within the older scheme. And then your pension choice, the McCloud choice, will be at retirement. And the choice will be, do you want to leave those benefits where they are in the legacy scheme, or would you want to move them into the 2015 scheme? And this applies to those people who never went into the 2015 scheme anyway, because they had that transitional protection. So let's look at the taxation consequences of this. So if you're going to be rolled back into an old pensions scheme, you could have a decreased tax liability. And actually, we've done the modelling on this for quite a lot of people, and a lot of people will have a decreased tax liability. Ordinarily, under self-assessment, you can only go back for 4 years, but government has said that they will compensate for all of the remedy period. There will, however, be some people who have an increased tax liability. Typically those who have got sort of mental health officer status that had that doubling after 20 years, or even new consultants towards the end of that remedy period. Now, HMRC have said that they will only collect for 4 full years previously. So we now have these in-scope years and out-of-scope years. So you're only going to have to pay tax if there's an unpaid charge from 2019-20 onwards. And then if you have paid any of these charges using scheme pays, well, you'll be able to go back and amend those. You will also be able to use it for any new charges. And if you have a new charge for 2019-20, well, you'll also be able to use the annual allowance compensation scheme as well. If you do, however, choose the 2015 scheme when you get to retirement, you won't need to reassess those 7 years. This is only done once as part of the rollback. So just to give an example of how that could look. So this is a typical sort of consultant whereby the pension growth in those gold bars is what happened from the 1995 scheme. So even when we see the 2015 scheme kicking in those purple bars, there is still growth in the old scheme because of that final salary linking and when increments occur. If you overlay annual allowance, and particularly when annual allowance taper kicks in, this number ends up with tax charges of over £16,000. If we roll that back and then replay it as though they were just in the 1995 scheme, well, the growth is a little bit lower. So the impact on annual allowance taper is a little bit lower. And in fact, for this number, they actually never breach annual allowance. So they will be due compensation of £16,265. Now, there's another element of McCloud that you need to be made aware of, and that's called contingent decisions. We've seen since the introduction of the 2015 scheme, members have opted out, they've given up valuable added years contracts, or they've hokey-cokeyed where they've left the scheme and rejoined, left the scheme again and rejoined, all to try and control that annual allowance growth mechanism. The government have confirmed that you can have retrospective membership, you can buy back those periods where you were opted out, you can buy back those added years contracts, including partial reinstatement as well. And all you need for evidence is just timing. So if you were out between October 2014 and April 2022, you will be able to buy back that membership. You'll need to make the employee pension contributions. They're going to have to be paid retrospectively with some interest. We're still waiting for some of the final details of how that's going to operate. We believe there will be some form of payment plan so you can spread those costs over a longer period. We expect there to be some element of tax relief within that mechanism as well. So do you actually need to do anything now with regards to McCloud? Well, no. You've already been returned to the 95-2008 scheme for the benefits that you accrued between April 2015 and April 2022. The McCloud Remedy choice is aiming to be in place for new retirees from April 2024. If you've already retired, well, NHS BSA are aiming to contact those existing pensioner members for their choice, hopefully 70% by the end of this year, but everybody by April 2025. But bear in mind, there are 277,000 members who have already retired. So there's quite a task in hand for NHS BSA. But if this is you and you are in that situation, then don't worry, your choice will apply retrospectively and it's going to be backdated to the date that you took your pension benefits. There will be some supporting information. You're going to get these remedy period saving statements that show the pension growth both before and after, and these should be issued by the 6th of October of this year. You'll also get the delayed 22-23 annual allowance statements by October this year as well. So you didn't need to include 22-23 within your tax return for last year. Once you've got that information, and only once you have that information, you can then use the HMRC's new digital service in order to report these changes. You can have a look now and have a play around if you want to. The URL is on your screen, or you can scan the QR code. When it was first launched, it was wrong. They had to pull it, and they had to do some more changes. Had a very good meeting with HMRC looking at how that could look like and giving some feedback on how they can improve. And I'm hoping we're going to get some changes to the system in the coming months. And one of the big questions is who's actually going to be paying to fix this? It's quite a lot of work. We've now seen something called the NHS Cost Claimback Service, which has been published by Department of Health and NHS BSA. And the principle is that the scheme can compensate for any financial professional fees to support the tax reassessment and direct financial loss associated with this discrimination. So to that end, at Medifintech, we've launched this mynhspensionclaim.com, where we're going to be providing this McCloud Remedy support to sort of facilitate translating all of that data through the HMRC digital service. It can't be launched yet because we need to wait for the actual remedial statements to come out, but we've opened up registration on the first come first served basis. We've had well over 1,000 people already register, so if you would like to use this service, then please do scan the QR code or visit the website or the URL on your screen now. Now moving on to the pension choice exercise. So the pension choice, it provided all eligible members of the NHS pension scheme with this one-off option, well, it was meant to be a one-off option, to move all of their membership from the 95 section into the 2008 section. And so in Pension Choice 1, you would have seen a very colourful guide with a personalised statement and a DVD explaining how all this works. And it's pretty impressive, in fairness, because those individualised statements gave you a good idea of what the differences of pension would be. And if you remember rightly, there was that graphic that showed that the closest you got to 65, then it was going to be better being in the 08 section. If you're going to be retiring earlier, then the 95 section would be better for you. So there's a good bit of information that came out from the scheme back then. But in fairness, times were simpler. We didn't have the issues of pension taxation. We didn't have the McCloud Remedy or anything like that. So there was a very good job by the scheme back then. We then saw a Pension Choice 2. So this second choice was announced when they introduced that 2015 scheme, because the 2015 scheme had a retirement date of state retirement age. So it could have been beneficial for some people to move their final salary benefits to have a normal pension age of 65. So this was only for people who had already had that choice statement from the Choice 1 exercise, but they decided not to exercise that choice at that point, so they'd stayed in the 95 section. But you had to be in the scheme on the 1st of April 2015. If you'd left, well, unfortunately, no choice. and it was targeted at people who weren't going to be getting that transitional protection. Now, for the Pension Choice 2 exercise, unfortunately, they gave you a little bit less information. So you had this general letter, there was a good online calculator, a whole bunch of fact sheets and decision trees. But bearing in mind, Pension Choice 1 wasn't that long ago, and you had that personalised statement. So you had a good idea on Pension Choices 2 as to what was likely to be a good outcome for you. And 10,849 of you actually did make this Pension Choice 2 election and moved those benefits from the 1995 scheme into the 2008 section. But what's changed since then? Because a lot has changed since that Pension Choice 2 exercise. We've seen the McCloud Remedy, as I've just explained and gone through. That has a significant impact on your choice and what's going to be right for you. We've also seen that special class status abatement abolished. If you have special class status, you might have been discouraged from the 95 scheme if you thought, well, I'm going to be working into my 60s anyway. That's all changed. We've seen those new retirement flexibilities been introduced into the 95 section, which weren't there before. And we've also had all of these changes to pension taxation, particularly on annual allowance and lifetime allowance. We even have the uncertainty on lifetime allowance. Even today, whilst Labour had previously said that they were going to carve out something special for public sector workers under lifetime allowance, they've now said that they're probably going to scrap that and just deal with lifetime allowance in general for everybody. So there's this whole uncertainty now with regards to pension taxation. That's worrying a lot of people. We've also had high inflation and significantly high inflation. And bearing in mind that 2008 section, it has those built-in mechanisms that react very, very strongly to high inflation. We've also had those changes to the minimum pension age. Admittedly, it doesn't impact that many 95 section members, but it does impact some. And we've also had a change in these GAD factors. So GAD factors are Government Actuary Department factors. They're the numbers that they come up with to try and work out how much to reduce your pension if you retire early. Now, we've seen them change a couple of times since Pension Choice 2 exercise, and they've actually been becoming more and more favourable. So there's a lot to take on board since Pension Choice 2. Now, we've seen as part of the McCloud Remedy, this Choice 2 revocation proposal, whereby if you opted to move your 95 service to the 08 section only as part of the Choice 2 exercise, you can now revoke that choice. And they said within the proposal that all members who made this Choice 2 election will be provided with the same or similar level of information as when they had the original election, and you'll have 3 months to decide, or longer, where the scheme administrator considers it reasonable. That last statement they've mentioned is very interesting because it's not been mentioned anywhere else, and I'll be very intrigued if there is scope for flexibility, because the 3 months, I think, is going to be very challenging for people to make a good decision. But importantly, we've had a lot of people ask us about this. This is not available for Pension Choice 1 members. If you moved across to the 08 section in Choice 1, you can't go back under this revocation proposal, only for Pension Choice 2 members. So if you do revoke your choice, it's going to be as though you never moved to the 2008 section. So that will impact two things. One, those retirement benefits, they will be based on 1995 section rules. So that's best of the last 3 years. It's going to be 80ths, 3 times that in order to get your lump sum. And also it will impact that McCloud Remedy as well. So for that rollback, instead of being rolled back into the 2008 section for those 7 years and working out your annual allowance position, you're going to be rolled back into the 1995 section and then revisiting your annual allowance calculations there. So there's a whole host of changes with regards to your pension tax reassessment for those 7 years. Now, from a timeline point of view, for NHS BSA, you should have been contacted by now with a letter. The letter started going out on the 20th of February, but bear in mind there's over 10,000 people that they're going to be contacting. And there is a deadline. So the deadline is you must decide by the 20th of May 2024. For anyone in any of the other nations watching, we haven't seen those forms yet, but the legislation is that they've got to be sent out by April. So you should have something soon. If you do nothing, then you will stay in the 2008 section. When you come to make your McCloud choice at retirement, you're not going to be given another opportunity to revoke the choice 2. They're two separate things. There is a very, very strict deadline on this for 3 months. Now, as far as supporting information goes, unfortunately, you're just getting that letter. There's no individual statement. There's no recent statement to look at. There's no online calculator either. So that letter basically just tells you what your options are, a few things to think about, and just to tell you that flexible retirement options have changed. So it is a shame that you're not being given this information. Admittedly, I am very surprised that NHS pensions have been able to deliver this even before the April deadline. I feel quite sorry for them. They've had so much to do. You think 1 million people going through the McCloud Remedy, and on top of the McCloud Remedy, we also had those pension scheme changes to the 95 section over the last year. So there's been a lot of work for NHS pensions to do. It's a shame that they haven't been given more time to implement this, or even to put this as a deferred choice underpin and leave it to when you actually take your benefits, like, for example, the McCloud choice is going to be. They have put some support information on the NHS BSA website. So again, if you scan that QR code or just visit the site, you'll see some information, including some examples. And now the examples are all well and good, but it's very tricky when they're not your circumstances, because everybody's situation is very, very different. Everyone has a different service pattern. Everyone has a different retirement goal. Everyone has a different objective when it comes to what they want to get in retirement. So it's going to be very, very tricky to do this from this information. They've also said within the letter that you should check your total reward statement to help you make a decision. Big warning on this. Total reward statements are only as good as the data that has been entered onto your pension record. We see lots of errors. We see lots of people who can't even get data on their total reward statements. And that latest total reward statement is only updated to the 31st of March 2023, and there have been some huge changes since that date. So first of all, the total reward statement, it doesn't include that rollback from McCloud that occurred on the 1st of October, where all of those benefits you built up between April 2015 and April 2022 moved from the 2015 scheme into your 9508 scheme. It doesn't include the 10.1% and 6.7% CPI that will massively, massively impact the 08 section pensionable pay figures going forward. I've got a case study that I'll show you how that impacts in a moment. But also, the total reward statement has got no support whatsoever with regards to the consequential impact on annual allowance by moving between the 08 to the 95. So let's look again at that case study. Now, if you remember rightly, when we were going through the 08 benefits and how to calculate pension pay, that was only up until the 31st of March 2023. So if we actually build that up to retirement age, so for this member is 60 this year, that pensionable pay has been adjusted by a bit of a pay review, but also the application of this inflation at 10.1% and 6.7%. So whereas before, on March 2023, the pensionable pay was 53,720, we see that go up a bit to 58,605, and then up significantly to 62,340. Not much of a difference in time span, but a significant change in pensionable pay. In addition, their total service in that 9508 scheme has been increased because of that McCloud rollback, and all of that service between those 7 years has been put back. So what was a TRS that showed a pay of 53,000 and a pension entitlement of 12,123, well, is now a pay of 62,340 and a pension of 18,722. So as I was saying before, be careful about trying to use that total reward statement to try and work out your numbers. I'd be very surprised if anyone can just use a total reward statement to try and work this out, because there have been significant changes. But what we then need to do is take that total reward statement and look at how the different benefits are based on which choice you make, whether you stick with the 08 section or if you move to the 95. So we do this all the time. So we're very used to sort of modeling people's pensions to their chosen date of retirement. So you can see here that their pension in the 2008 section is that 18,722. But if they want to take this at 60, there's that actuarial reduction. So they only get to get 79% of their pension. So that takes it down to 14,790 within that 08 section. They got a little bit of 2015 benefit. So if you add all of that together, if they'd stayed in the 08 section and took all of their pension benefits, then at 60, they would have got a pension of £15,926 and a lump sum of 26,055. If they wanted to, they could have decided to get for a bigger lump sum. You can see those numbers on your screen. There is also, they could have chosen to move into the 2015 scheme, and there's a whole host of other numbers, but let's just focus on the legacy scheme as an easy way to compare and contrast the 08 section versus the 95 section and pension choice 2. If this member were to revert to the 95 section, well, you won't be surprised that age 60, they're going to have a much bigger pension. And overall, interestingly, the pension income isn't that much higher because of that huge impact of inflation that has happened to those 2008 benefits. But the increased lump sum definitely outweighs taking the 08 section. So if this person knew they were going to be retiring at 60, then going back to that 95 section is a bit of a no-brainer, and very much sort of emulates what you would have seen back on that pension choice 1 documentation, and that those going earlier tend to be much better off in the 95 section. Now, let's say, for example, this member were to retire at 65, so we've progressed their pension another 5 years, but please note, benefits can significantly change depending on wage inflation and CPI, and the next 5 years is a very long time. In this case, we saw their pensionable pay sort of actually move a bit like a wave, so it crests up a little bit and then goes down as the impact of inflation, as some of those older pensionable pay drops out of that 10-year window. And we'll see that. So if you've got a lot of time to go, then the big impact of the recent CPI you might see falling off going forward. But let's do that comparison again. So 08 section, pension of £23,763 and a lump sum of 26,450 versus if they had stayed in the 95 section, a pension of 20,333 and a lump sum slightly increased at 44,622. Now, it's very easy for us to try and compare these two because we can sacrifice some of that 08 pension to give the same lump sum as you would have got in the 95 section, and you'd have only needed to reduce the 08 pension down to 22,248 to get the same lump sum. So quite obviously, it would have been much better for that member to stay in the 08 section if they were going to retire to 65. And that kind of emulates what we saw on pension choice 1 and all of that documentation. But what now throws a bit of confusion into this are those new rules on pension flexibilities. So let's say, for example, the member decides, you know what, I want to take my 95 benefits at 60. I might then work a little bit less and then take my 2015 benefits at age 65, and let's compare that to what I would have got if I'd gone down the 08 route. So we already know if you carried on to 65 and stayed in the 08 section, your pension was at 23,763, your lump sum was the 26,450. If we compare that to taking the 95 benefits at 60 and then leaving the rest till 65, well, your pension is lower, 20,333, your lump sum is higher, but remember, you're getting another 5 years of that 1995 pension. If you've got special class status, it's even longer, it's only for 10 years. So for special class status, particularly as there's no abatement, this should be potentially a no-brainer. Now, in this scenario, this member would get an extra £59,496 worth of extra net income, because when we add that pension to their ongoing employment income, they're still a basic rate taxpayer. So to get the same overall net income with that extra lump sum, that would need to reduce that 08 section pension by nearly £6,500. So for this individual, for their service pattern and what they want to achieve and what hours they want to do, it looks like going back to the 95 section and then exercising some of those pension flexibilities could be a better route for them. But I stress, it all depends on your individual circumstances and what your service pattern is and what you want to do. Because for other people who might be in different tax positions, who might have different service patterns, who might have one of those trusts that won't even entertain partial retirement, and you don't want the risk of a retire and return because the employer might not give you the same type of contract that you're on at the moment. It will very much depend on your individual circumstances. So some of the modelling that we've been sort of showing you this evening is a service that we do provide. So we provide our NHS Pension Support Standard service, where we can analyse existing pension records, we check for errors, we then project those benefits to chosen date of retirement. So this is for postdocs, GPs, dentists, senior managers, any of the nations. And it considers factors such as early retirement, late retirement, partial retirement, annual allowance, maximum pension commencement lump sums, scheme pays, as well as that McCloud Remedy and the rollback. Model any scenario that you can consider, such as salary sacrifice, lease cars, reducing hours, taking on additional responsibilities. So this is aimed more towards high earners because of the tax considerations. There's a Teams call as well with one of our specialists. This is not financial advice. We're not a financial services company. And that service is £650 plus VAT. We've had approaches by quite a few people, particularly via sort of the Facebook group that we've been sort of helping out on, for those who are Agenda for Change staff. And so what we've done is we've developed a light version of our standard service for Agenda for Change staff, because we're finding that once we have simpler service patterns, not having to deal with tax, we can actually get through this type of analysis a bit quicker. So we're looking to save on that time saving as a cost saving to members. So we have this light service that focuses on those pension projections and the impact of McCloud Remedy, which we're releasing at £300 plus VAT. We're only going to release this through this webinar and also the Facebook group. There is a very limited capacity that we can do on this basic service. But one thing that we have said is that both in the standard service and the basic service, we will do that comparison between sort of the 95 scheme and the 95 section and the 08 section as well, to help sort of give an understanding on those numbers. We have no idea whether or not these costs could be recoverable under the NHS cost claimback service. The definition is that if you suffer a financial loss, a direct financial loss as a result of the age discrimination, then that's what the scheme is there for. It also goes on to say that one of the conditions is that you were unable to access the type of information from the scheme. Although they have specifically said that they don't expect to be compensating anybody for this type of work for the pension choice revocation. I have a feeling that's going to be challenged because the landscape is so more complex than back when we had pension choice 2. And whilst they have sent out a general letter like last time, you don't have the background like you did before with the pension choice 1 exercise and all of those numbers. And you don't have an online calculator to try and help you through as well. I want to reiterate what I said at the beginning. The NHS pension is exceptionally complicated. There are a lot of support groups out there. The Facebook group that I mentioned earlier has got nearly 36,000 members. I always urge a bit of caution because some people might answer the question without the most correct of answers. But there are a whole group on there, especially the admins, and there are certainly a few people that answer a lot of the questions, and you'll soon identify that they know their stuff. And it's very good actually that a lot of the people do know their stuff. It's also a group that I sort of dip into from time to time as well to sort of answer some of the questions, or particularly when we get into some of the more nuanced and niche areas. And as I said, there's also those podcasts from Medics Money. So there's a lot of support out there before you have to start paying for services from companies like us. So I would urge you to try and use those forums for support. If you do want help from us, then please, by all means, do come and see us, and the services there on your screen. We're going to do some more webinars throughout the year. This is an exceptionally complicated year for members because of McCloud Remedy and what's going on. But I just wanted to say thank you very much for attending. Thanks very much for staying with me. I know it's a ridiculously complicated subject, please do go back and review and refresh. Remember to click on all of those QR links. It gives you access to all of those additional resources. But again, thank you very much for attending. I'm going to draw everything to a close. Good night.